It's an honor to be with you today. As he said, I am Brian McKenna, the new Deputy Director at the Reproductive Health Supplies Coalition.
And I'm Ellen Thompson, the Senior Program Officer for Reducing Stockouts at the Coalition.
Hi, and I'm Apollo Gonzalez. I am a consultant with an agency called Echo & Company. We're a communications and campaign agency.
Nous sommes là aujourd'hui parce que nous aimerions bien qu'on commence à parler la même langue quand il s'agit des ruptures de stock.
Estamos aquí el día de hoy porque queremos empezar a hablar el mismo idioma cuando hablamos de desabasto.
We are here today because we would like for us all to begin speaking the same language when it comes to stockouts.
We've all had the experience ourselves before. You arrive at a store in search of your preferred brand or product, and the shelf is empty. You might be looking for your favorite brand of tequila, or those shoes you saw on your friend last night, or the new smartphone that you just must have. For many of us, this is a frustrating inconvenience. We can substitute something else in its place or walk down the road to find what we're looking for. As most of us in this room know, this is not the case for many of the clients we are serving in our line of work. A woman, let's call her Esperanza, walks from her village and waits in line at the only available private or public clinic in the nearest town, only to find that her preferred contraceptive method is out of stock. Perhaps it is the one that she is currently using, or perhaps it is that only a short-term method is available when she prefers an IUD or an implant. Esperanza finds herself making a difficult choice. But this is not the choice that we seek to provide to her. It is a choice between what is available and the alternative, a method not particularly suited to her needs or risking an unwanted pregnancy. We want her to have a choice between a full range of quality contraceptive products so that she can make the decision herself. Despite our best efforts, stockouts of contraceptives continue to be a chronic problem in many countries. As someone who worked for PSI for 11 years in Southern Africa, I'm acutely aware of the fact that stockouts are difficult to address because supply chain management is challenging in the best of circumstances, and we are almost never working in easy environments. There is no single reason for stockouts, and many times they expose weaknesses in our systems that we would rather not highlight. We all know that they are an important issue, yet we are all speaking different languages in trying to address them. We are using different definitions and metrics. We are stocked up when our partners are stocked out. With good intentions, we are doing what we can to make improvements, but without a coordinated global effort, we will continue to speak past one another. And Esperanza, and Fatima, and Mercy, and Mbula, and Krishna find themselves in a difficult situation without the choices they deserve. In fact, the choices to which they have a right. What can we do to solve this problem? The Reproductive Health Supplies Coalition proposes to step into this space by employing all of its levers of change to lead an effort to make a tangible, measurable difference when it comes to addressing stockouts. Now, if you believe the demographic and health surveys, stockouts represent only a small percentage of unmet need. But does that really compute? Whenever we look, we actually find much higher levels of stockouts.
So let's start by taking a look at the landscape of stockouts. The reality is that it's a very serious problem on many fronts. In 2 districts in Senegal, a study funded by Gates found that health facilities were stocked out of injectables almost half of the time at 43%, and of implants nearly all of the time at 83%. In well over half of these cases, the stock of each was available at the central level. Worse figures were seen in Nigeria, with health facilities in Kaduna district spending more than half the year, or 65% of the time, stocked out of injectables, and a third of the year, or 28% of the time, stocked out of orals. An assessment of 69 facilities in Uganda found stockout rates of 50% for condoms, 12% for injectables, and 10% for pills. Lastly, in 2004, Rwanda reported stockout rates of 33% for orals, 21% for injectables, 37% for implants, and 61% for male condoms. Even more troubling, however, is the limited and fragmented nature of the available data on stockouts, especially at the health facility level. Countries and organizations resist gathering this data and making this data publicly available. But let's not forget to go past the numbers. The difficulty in getting supplies to people who need them, whenever they need them, is at the core of our coalition's mission. We all know that this is a problem. We see it in our work, directly and indirectly. As tangible as the empty shelf may be, this campaign is about more than that. The consequences of Esperanza or Krishna leaving clinics empty-handed are real, and the impact of stockouts ripples up and down the supply chain every day. We've heard the frustration of health facilities wondering why the product hasn't been delivered. The frustration of central medical stores saying they don't receive orders. On a recent country visit, I was told that only sick people go to health facilities, and sick people aren't thinking about sex. Stockouts limit the choice of women, they disempower health workers and supply chain operators, and they distort our view of the market. Nevertheless, there's a lot of great work being done by coalition members on the ground to fight stockouts. The ongoing rollout of the Inform Push model across Senegal has reduced stockout rates in 9 of the 14 regions to commercial levels. USA Delivers top-up models saw stockout rates in Zimbabwe reduced to virtually zero. The Rwandan government and its partners achieved significant decreases in stockout rates from 2004 to 2011, where oral contraceptives dropped to 1% stockout rates, injectables 2%, implants 3%, and male condoms 3%. One provider that participated in a pilot test of the Respond Project's COPE tool for contraceptive security remarked, "Before we would wait until the contraceptives ran out before we even thought about filling out the R&R and requesting new drugs. Timeliness was not on our minds. Now, after COPE, we understand our own responsibility to order. We didn't understand before that shortages and stockouts were our fault." This is just a sample of all the projects taking place around the coalition, with many more members engaged on the issue. Now, even here at the coalition, we've been able to show that counting stocks matters. Recent analysis of stock-level data from central warehouses submitted to the coalition's procurement planning and monitoring report showed that the percentage of reported stockouts in PPMR reporting countries declined steadily since tracking through PPMR first began, from 14% of reports in 2008 to 8% of reports in 2014. This trend occurred in spite of the fact that the number of reporting countries more than tripled from 2008 to 2014. But despite all of this good work, we have not yet succeeded as a community in making the whole greater than the sum of the parts. We cannot create the momentum required to even sustain this good work, let alone build the momentum. One thing blocking us is being able to effectively define what a stockout is. I mean, after all, isn't a stockout a stockout? Let's look at an example of data on percent of facilities stocked out for a hypothetical country. Here we can see organizations are reporting different stockout rates, 40%, 30%, 70%. When you look at the indicators they were reporting against, you begin to understand why the numbers appear to be so different. In the first case, 40% of all facilities do not have the product today. In the second, 30% of facilities that offer the product do not have the product today. And in the last, 70% of these facilities had a stockout of the method any time in the last 6 months.
So as we just saw, we cannot distinguish between good or bad, half full or half empty. We cannot compare measurements across agencies. Some measurements tell us stockouts are not a problem. Others tell us it is the problem. We are asking different questions and providing different answers. This was never more apparent to me than when preparing for this campaign. We heard from many of the experts responsible for collecting information on a global level, who all said that a coordinated effort to speak the same language about stockouts is sorely needed. They don't have coordinated information on stockouts because we are not coordinated in our efforts to provide it. We cannot track global progress towards reducing stockouts. As I said, we are either using different measurements or we are not measuring at all. We are reluctant to share information because we think it speaks poorly about our efforts. We cannot motivate all in our community to care about stockouts or translate that care into action. We are speaking past one another. As we found in preparing for this presentation, data to use for advocacy is not easy to come by. The coalition is not trying to solve all that's wrong, nor do we intend to simply add to the work that's going on. We are aiming to fill a very specific niche to which we will employ all of our levers of change working across all of our pillars. In doing so, we intend to bridge the divide. Since 2012, the coalition has been focused on addressing the scourge of stockouts. We have always said that commodity security is too large and complex an issue to be successfully addressed by any one agency or sector. Now we have a unique opportunity to do something about that. As a convener, a broker of partnerships with a respected name, we are uniquely positioned to do what few others can. To add value to the dedicated work of our partners, and as John said in his introduction yesterday, to help make the whole greater than the sum of its parts. In doing so, we can help bridge the communications gap. Our aim is to get our community to speak together with one voice. What do we mean by that? It means communicating in a language we all understand. An example of efforts in this area is the ongoing work of the System Strengthening Working Group to develop a suite of common indicators that we can all use to measure stockouts. It means collaborating, working together to achieve a common goal we all understand. As we will see in a moment, this relates to getting the main actors in our field to adopt, measure, and report to FP 2020 using the same indicators, and to the efforts of all of us in our community. It means joining the conversation, globally and at home, and contributing information to it. We aim to see all of us, donors, civil society, governments, and private sector, contributing to the dialogue on stockouts, as well as measuring and reporting on them regularly. It means recognizing stockouts as a human problem that demands all of our attention. It is not only a simple technical challenge that requires the experts. We all have a role to play. Much of this is not new to us, but this campaign has only really begun to take shape for us over the last year. Apollo is going to talk in a minute about that, but for the moment, I want to make sure that you understand what has become clear to us since the time that we started, and with real intention that the coalition intends to take action. It is time we started talking about stocks. It's time that we started taking stock. Taking stock of opportunities, taking stock of our community and where a willingness to participate exists. Taking stock of the successes you, our membership, have achieved. Taking stock of the impacts on people's lives when we are able to succeed. Taking stock of the available body of information, and taking stock of how far we need to go, not just in the short term, but for the foreseeable future. So today, we're launching the first phase of our campaign we are calling Take Stock. Take Stock is a participatory campaign that leverages the strength and knowledge this community holds, and it is at the heart of the coalition's priorities.
So I want to take just a couple of minutes to talk about Take Stock, not just the name, but the campaign itself. First off, in the last several months, we've interviewed lots of folks who are working on the issue, both technicians working on technical solutions, people who have been on the ground. We've read the reports, we've seen the videos, we've done an incredible amount of reading around the issue, and that work continues and will continue as the campaign rolls out. But one thing that we've heard loud and clear as we've talked to everyone is that people want one thing, and that is action. Take Stock, the name itself, describes the campaign in a language not buried in jargon, in a language that we all understand, and it evokes a call to action for the entire community. It's a departure from what we see as negative language of stock out, and acknowledges not just an empty shelf, but a full one as well. We believe that this positive approach and language to take stock will help us overcome some of the challenges created by the language of failure or shortcoming, and instead reframe it in a language of success and innovation and empowerment. At all points of the supply chain, anyone can take stock of the work that they are doing to end the occurrences of stockouts. As Brian said, we envision a campaign that is at its core participatory. History shows, and our work at Echo & Company shows, that effective campaigns are those that happen when members of the community work together to make change. Take Stock is designed with you, the membership, and the communities you serve in mind. We hope what you're going to hear next about how Take Stock will take shape will get you as excited as we are about being a partner in the road of launching this campaign. I'm going to turn it back over to Brian here in a second, but I just wanted to say that we are holding true to the fact that you will be participating in this, and at the end of our presentation here, we're going to take some time and open it up to listen to you and get your involvement in this. So stay tuned for that here in just a few minutes.
Thanks, Paulo. As I hope we have demonstrated, there's a pressing need to get our community behind efforts to track progress in the family planning space. In order to address this need and to make a more tangible, measurable difference, our target for Take Stock is by 2016, the world's largest bilateral, multilateral, and non-governmental providers of reproductive health services will be reporting stockout data to FP 2020 on an annual basis using a common set of indicators and one universal indicator. Why 2016 and why annual? Data is gathered on an annual basis by FP 2020 in the middle of each year. So this means that we aim to have all data submitted by mid-2015 in order to make it into the 2016 report. Why bilateral, multilateral, and non-governmental providers? Here, we are looking to the main players in the implementation, collection, and reporting of data on stockouts. Bilateral organizations such as USAID, multilateral organizations such as UNFPA, and NGOs such as IPPF, PSI, and MSI, for example. Why a common set of indicators? The coalition is working currently with members such as UNFPA and USAID Deliver to finalize a suite of indicators for recommended use in measuring stockouts. Why a single universal indicator? As part of the suite of indicators, of which some will be optional, one universal indicator will be used to measure and report stockouts by all actors. A single indicator has been an objective of many in our community for some time, and this campaign aims to ensure that it is adopted, tracked, and reported regularly. And so it is within this spectrum of speaking with one voice, we have set a target for ourselves and our community to which we will hold ourselves accountable. It is an immediate challenge that rests squarely on the shoulders of key service delivery supporters in this room. But it is equally a challenge for many others here and those listening around the world. Without active engagement from all of us, we cannot move forward.
As specific as this target might appear on the surface, it is by no means something that can be delivered by just a few actors. It will take a community to, one, develop a common language. As Brian just mentioned, in the coming months, you will hear more about our single definition of stockouts and a harmonized suite of indicators to measure them. And we've been working with our partner, JSI, to make this happen. JSI, if you could wave your hand. Thanks. 2, put our new language to effective use. We are committed to achieving our target by 2016, and we encourage you all, large organizations and small, to join the advocacy effort to adopt our new language of stockouts. 3, inspire action and drive conversation by highlighting the consequences of silence, by bringing the voices from the field. We are excited to launch our research to measure the impact stockouts have on women and their families with our partner, IBIS Reproductive Health. IBIS? Thanks. 4, invest in solutions to address the problem. We have set aside resources to support new and innovative efforts at the country level. Our partner, HEPS Uganda, in the next 2 years will engage communities in Uganda on the issue of choice and availability of family planning. HEPS? Thanks. 5, bring new partners into the conversation. We launched a research project to address contraceptive stockouts in faith-based organizations with our partner, Christian Connections for International Health, which will drive additional interventions at the country level in this under-supported sector in the health system. CCIH? Thank you. Lastly, we will launch a call to action, advocating at all levels. We will make use of the skills we applied so effectively under Hand to Hand to get people moving. We will seek out commitments from our partners in support of our goal of reducing stockouts. So there's a lot going on in the next few years around the coalition to address this problem. Let's take a minute to imagine what we could do if stockouts were no longer a problem. Let's go back to the case of Rwanda. If Rwanda were to replicate its success in reducing stockouts today, it would result in 43 maternal deaths averted, 543 infant deaths averted, 21,000 induced abortions averted, and 37,000 unintended pregnancies averted. Think about what it would mean if we did this in every country, of every size, and what it would mean for women around the world.